Norovirus is viral infection which causes gastroenteritis. Gastroenteritis means inflammation of gastric or stomach and intestines. Norovirus is one of the most common viral infection which causes diarrhea and abdominal pain, and usually it spreads easily in crowded places such as schools, nursing homes, cruise ships, and transmission happens with contaminated foods or water, and transmission is very easily. That's why it causes such huge outbreaks every year in many places. First and most common symptom of norovirus is diarrhea. Diarrhea occurs around 90% of cases of norovirus infection, so most common symptom is diarrhea, and this diarrhea is usually watery and sudden and frequent and severe. So sudden diarrhea out of nothing, watery, usually it's very watery and severe. Even for adults it's very severe, and for adults also it creates huge discomfort, and in kids frequently it causes crying and discomfort because of this severe diarrhea. So diarrhea is most important symptom of norovirus infection. Second most common symptom is vomiting. Vomiting usually is forceful and often comes unexpectedly also, and in children usually this vomit occurs right after eating. Also anytime it's possible, but in many cases it happens right after eating, and many kids refuse to eat because of fear of vomiting. So vomiting is presented in 70% of cases. Nausea is presented in 60% of cases. Nausea usually is first symptom of norovirus infection. Its first symptom. Usually this infection starts with nausea and then it's continued by diarrhea. And nausea, what means nausea? Nausea means that person feels he or she is sick and he has abdominal discomfort and feeling of queasiness, feeling of wanting vomiting, but not vomit, just feeling. It's nausea, and nausea is third most common symptom. Fourth most common symptom is abdominal cramps or abdominal pain, which occurs around 50% of cases norovirus infection. This abdominal pain is sharp and intermittent, and it happens because of inflamed mucous membrane by this virus, and because of inflammation causes abnormal muscle contractions. That's why person has abdominal cramps and abdominal pain. And fifth most important symptom is fever. Fever is presented around 30% of cases. So fever is not the most common symptom, but it sometimes happens, especially if this viral infection is more severe. And why fever is important? Because fever creates unfavorable area for viral and bacterial growth, and fever also stimulates immune system. That's why fever is important. And what is treatment? Treatment is rehydration. First and most important treatment is supportive therapy and rehydration. Rehydration at home means 1 liter water and 6 spoons of sugar, 6 teaspoons, and 0.5 teaspoon of salt, and this mix a person should drink slowly. Also, it's important to reintroduce food as possible. Start with solid foods such as bread, which are easily digestible, for example bread, rice, and some blends also such foods, which are primarily simple carbohydrates like bread and rice. That's all I wanted to say. Norovirus is very common infection, extremely common infection, but usually it has favorable prognosis, and in 1 to 3 days person will be much better already. And if there is question if norovirus creates immune response for next infections, it creates some degree of immune response, but this immune response is not strong and long lasting. It lasts around maximal several years, and it's only for specific strains. So there is many strains of norovirus, more than 20 strains. That's why if person is infected one strain of norovirus and he or she has immunity against it, it does not automatically mean immunity to another strain. So it's important to note that norovirus does not create strong and long-lasting immunity. That's all I wanted to say. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.